Okay, so the head of a surgical department at a university hospital notices that the rate of near misses related to the patient identification process prior to surgery has increased over the past year. She decides to implement a monthly recurring meeting in which selected cases are presented and discussed. The aim of the meeting is to identify the individual actions that led to errors by providing a non-punitive space for self-reflection and to determine strategies to prevent their recurrence. Both surgeons and surgical trainees, including residents and students, are asked to attend the meeting. Which of the following is the most accurate description of the activity initiated by the head of the surgical department? Options: root cause analysis, lean process improvement, plan, do, study, act cycle, morbidity and mortality review, failure mode, and effect analysis. Here we had a head of surgical department who was noticing a near miss related events, right? So such as identification process prior to surgery. Some of the informations were kind of getting missed and it has been increased over the past year, and she decided to see why was it happening and try to discuss the cases that even led to these kind of near misses, such as, so she kind of selected some of the cases that led to those near misses events and she asked to present and discuss through the individual whoever was there, and so they will be able to kind of reflect on what happened during the procedure, right, and why that mistake happened and how do we prevent it going forward, right? So these kind of discussions, what we call morbidity and mortality review. So the answer to this question is actually D, morbidity and mortality review. It's actually a meeting where we kind of present cases um, and we discuss, what went wrong, what went right, what happened during the procedure, and then how do we stop making the same mistakes again. It's kind of a peer review activity, so everyone is kind of free to discuss and present cases. It helps with individual improvement as well, and it also helps increase situational awarenesses at some point. Okay, so in this case, these kind of near misses events were happening kind of over the past year, and so she decided to start these monthly meetings to discuss these cases. All right, now why the other options are wrong? So first is root cause analysis. As the name implies, we are kind of looking for what was the root cause for that particular problem, right? Now the root cause analysis can be used in this situation, but it's going to include a more thorough kind of investigation than what the department, the head of department kind of started. She just started a monthly meeting to see where we went wrong and what can we correct. Whereas root cause analysis is going to include everyone in case of physicians, nurses, the technicians, everyone, whoever was there when the problem happened, what happened and how that led to particular consequence. So it kind of includes a whole investigation process. It can include materials, it can include the devices or the equipment, the process that went at that time, the environment, the people involved, the management team involved. So it kind of involves a lot of people, and it can also involve interviewing and discussing certain things with few people. But the root cause analysis is kind of a more thorough than morbidity and mortality review. And according to me, it only happens when the problems are kind of big enough where you actually have to think about, what went wrong, and how can we correct it, going from the basis, going from the foundation in itself. What if something is wrong in the system and we are looking for an individual error, so that doesn't make any sense. Morbidity and mortality review could be an individual error, whereas root cause analysis is going to look at the whole process. It's going to look at the whole system. All right. Lean process improvement. So lean process improvement is kind of is going to help us prevent unnecessary tests. So it kind of saves time, energy, and resources. Lean process improvement is going to help us save these times, energy, and resources, and invest it in people who actually needs them. Okay, so that is lean process improvement. Plan, do, study, act cycle. As the name implies, you plan. Okay, let's say you plan an intervention or you plan to improve something. okay, or to test a medication, something like that. You test it. You test it in a group of patients or you test it in a person. You study. That means you study the outcome. Okay, you test it. Now you study the outcome and then you act. That means then you implement your intervention or whatever innovation you did. Okay, so you plan, you do it. That means you test it in a certain number of people, you study its data or its outcome, and then you implement it. So that is the plan, do, act, study, act cycle. All right. Now, failure mode and effect analysis. This is a prospective way of looking at what can go wrong. You know, what I mean is that in failure mode and effect analysis, let's say, for example, we are kind of trying a device, right? So in this particular new device, we have to prospectively think, you know, what if this device fails? What are the reasons for its failure? And how do we prevent it? So that is failure mode and effect analysis. Going forward, you have to think and you have to improve. That is failure mode and effect analysis. All right. Whereas in this case, it was just a monthly meeting that she started, right? And she was just looking at individual based errors, because here we are trying to look at patient identification process prior to surgery, which is done by certain number of people in the OR or in the operating room. Okay, we are supposed to look at the individual errors over here. Moreover, admitting that you made a mistake in this morbidity and mortality review is not gonna make you even look bad, or is not gonna even kind of, nothing is gonna happen to you per se, like in terms of lawsuits or in terms of any other actions that the hospital can take. That won't work in morbidity and mortality review.
Thanks for watching. Please give a thumbs up and subscribe for more.